Dr. Diaz, I would like to talk to you about implants. Actually, I would like to talk to you about instant implants. There seems to be a form of implant out there where you instantaneously can walk away with it all done, where with a normal implant, apparently you need to wait anything between 2 and 5 and 6 months before the crown or the cap can be placed. Can you shed some light on that situation?
Sure. I worked with a specialist a few years ago that was doing this or trying to do this type of implant. I will tell you that the standard today is still the implant that we let heal 3 to 4 months. For the instant implant to work, there are so many things that have to be just right, and still the rate of success isn't as high as it is with the implant that we put in and then let heal for a full 3 to 4 months. So in our practice, we stick with the type of implant that we do let heal for a little longer, because the success rate is higher. It's just a much more predictable type of restoration. And most of the specialists that we work with, either gum specialists or oral surgeons, they all agree that the better type of implant is the type that you let heal. That's not to say that someday we will be able to put an implant in and load it, in other words, put a tooth on it right away. I think they're making progress toward that, but I don't think the technology is quite there yet. So I'd rather be safe, let it heal, and then load it with a tooth after 3 or 4 months.
Got it. So basically what you're saying, it's a little bit like building a house. You pour the foundation, the cement, and you let it sit. You just don't put the whole, so that it has to be settled.
That's right. That's
okay.
Right. Yeah.
Settled.
When the implant is placed, the bone will regrow around the implant. If you don't allow that to happen, it's just not going to be as stable when you first put it in.
Right, because if you chew on a spare rib and you kind of take it out, I mean, that tooth, even though it's only a half an inch or quarter of an inch long, it acts like a crowbar inside there, I suppose. And if it's not solid there, I can see why you're just asking for trouble.
That's absolutely correct. That's a good example.
But let me ask you, so the people who need to wait, which is everybody, you are able to fix them up with some temporaries which are not too heavy structured, but at least they're not running around with missing stuff here, right?
That is correct. In areas where it's aesthetic, or really in any area the patient is uncomfortable not having a tooth, there's different types of quickly made and easily made and fairly comfortable temporary devices that will replace the tooth. So that way there's not the embarrassment of being out in public and having a missing tooth. And again, they're pretty simple to make. So it's not a big deal to replace a tooth while the patient's healing from the implant.
Wonderful. So basically what we learned here is do it right the first time, just do it and shoot for that long, everlasting success ratio rather than gambling.
That's right.
Thank you very much, Dr. Diaz.